It is about 6 months since Nigeria recorded the first case of COVID-19. The country has recorded over 50,000 cases and more than 40,000 discharges. In the past few weeks, the country has also recorded reduced active cases. Many have described this development as an early phase of flattening. Today on Sound Health, we will take a look at the recent statistics of recorded COVID-19 cases. I am Olasumbo Modupe. Welcome to the show. We begin the show with COVID-19 updates.
A number of vaccines are now in their final stages of clinical trials, and hopefully there will be multiple successful candidates that are both safe and effective. As supply increases, the next stage of the vaccine rollout will be expanded based on an assessment of each country's vulnerability to the virus. Director General of the World Health Organization, Dr. Tedros Ghebreyesus, who gave the assurance, said through the allocation frameworks, COVAX will ensure that low, middle, and high-income countries will all receive the vaccine in a timely way as soon as there is supply of a safe and effective vaccine. WHO has invited countries to join its COVID-19 vaccine global access COVAX facility, a mechanism designed to guarantee rapid, fair, and equitable access to COVID-19 vaccines worldwide. The goal of COVAX is to deliver 2 billion doses of safe, effective vaccines that have passed regulatory approval and/or WHO pre-qualification by the end of 2021. Earlier, 75 countries expressed interest to protect their populations and those of other nations through joining the vaccine facility. The Presidential Task Force on the COVID-19 pandemic has vowed to punish international airlines with a fine of $3,500 per passenger if found to have breached international flight protocols. PTF National Coordinator Dr. Sani Aliu, who disclosed this, also revealed that incoming passengers would henceforth pay for their COVID-19 test. Speaking further on the new protocols for inbound international flights as the nation prepares to resume international flights, Aliu noted that the new protocols will be strictly applicable to passengers coming into the country. He said the PTF has come to the conclusion that it will now be safe to shorten the isolation period for incoming passengers from 14 days to 8 days. The committee has also narrowed the period of validity of PCR tests, currently from 14 days to 7 days from the 29th of August. Preferably, the PCR test should be done as close as possible to the point of departure for Nigeria, from 48 to 72 hours. Results that is valid for 7 days will be accepted. Lagos State Commissioner for Health, Professor Aki Abayomi, has tested positive to COVID-19 after a close contact with someone with the virus. However, he is doing well with no symptoms and has proceeded on 14 days self-isolation and home care. The Lagos State government has listed some modalities, set of protocols and guidelines that must now be put in place and implemented by hospitality and tourism establishments for the reopening of business activities in the state. Commissioner for Tourism, Arts and Culture, Mrs. Uzamat Akimbile Yusuf, explained that the protocols and guidelines are meant to ensure the health and safety of all guests and staff in all the facilities involved. The rules affect all accommodation establishments such as hotels, motels, apartments, suites, inns, guest houses, and so on. Tourism enterprises like event centers and food establishments like restaurants, eateries, fast food, lounge and bars, and cinemas. She stated that aside the general safety protocols, encouragement of cashless transactions, disinfection of premises and buildings, among others, are germane. Akimbile Yusuf stated that owners of hospitality establishments are now required to offer 50% of their space capacity to guests for now. in order to maintain physical distancing in addition to the separation of dining tables. Also, there will be no buffet serving arrangements. All guests over 18 years old must be made to sign a COVID-19 form at the reception that has the name, address, and phone number for easy contact tracing purposes. Globally, there have been above 23 million confirmed cases of COVID-19, including 805,902 deaths reported. In Nigeria, over 50,000 cases have been confirmed with more than 900 deaths.
Still Sound Health on Lagos Television. I am now being joined by Dr. Maduafokwa, a public health physician, via Skype. She will share her thoughts on recent development in flattening the COVID-19 curve. Welcome to Sound Health, Dr. Maduafokwa.
Thank you so much for having me. I appreciate it.
Okay, let me start by commending you and other frontline workers' efforts since the beginning of the pandemic.
Thank you so much.
Okay. What is your assessment of efforts in flattening the COVID-19 curve so far?
Okay, I will commend the Lagos State government, the Federal Republic of Nigeria on the efforts applied so far. As we can see in recent weeks, the curve has sort of plateaued, if you will. So I would actually ascribe that to some of the effort that we've put into messaging on social distancing, messaging on personal hygiene, enforcing some of the protocols during the lockdown.
Okay.
But I would also caution us, because we need to also remember that Nigeria as a country, we're actually not testing enough people. I think our testing rate at this point is about 0.015, which is extremely low compared to other countries which are testing up to about 20% of their population. So I would say we need to be optimistic, but we need to be cautiously optimistic.
Okay, how true is the statement that the cumulative amount of active cases is an indication that the country has entered an early phase of flattening?
Okay, so ideally that would be a good indicator. But like I already said, it has to also match with the level of testing. So if you're not testing enough people, you're not going to be able to catch enough cases. So this is something we have to always bear in mind. In addition, we know that ever since the Lagos State, even the federal government, began to recommend home-based care, we found out that a lot of people will just have mild symptoms and just manage themselves at home and not even bother to get tested. In fact, I know someone who I had to practically beg to get tested. They just had chills for like 1 or 2 days and they were fine. But after I pressured them, they went and got tested and they found out they were positive. So we have lots of people that have these mild symptoms and they don't get tested, and so these cases are not captured.
Okay, let's take a look at recent statistics. What is your take on the increase in discharge rates?
Okay, so that's a very welcome development. One thing that we have noticed in this pandemic with the Nigerian experience is that our case fatality rate has been lower than average. So our case fatality rate at this point, I believe, is at 2.1%. So that tells you that a lot of people are recovering from this illness as opposed to people that were losing to this illness. So the recovery rate is quite high, which is actually fantastic. So that's one of the things that, with time, we're going to study and actually find out exactly why our case fatality rates is so low. But But the truth is that is a very welcome development.
Okay, does this mean that we are close to the end of the pandemic in Nigeria? Is it too close to say that?
Okay, so I would caution against us making that conclusion. And why do I say this? I say this because, like I said initially, we're not capturing a lot of the cases. And then when we look at some of the countries like Israel, for example, like Australia, for example, that the epidemic curve came down so low to so negligible numbers of people, and they all relaxed and said, oh, this is over. And then what happened? They opened up their economy, and again, there's a spike. We know that in Israel, the spike currently is even higher than the initial spike. And I believe in Australia, the city of Melbourne has actually gone into lockdown. So we need to be very, very cautious when we make those assumptions. And I believe those are assumptions that we should not actually make.
Okay, Dr. Maduafokwa, let me quickly ask you, is it too early to close some isolation centers like the case in Lagos State, being the epicenter?
Okay, so the isolation centers, we know that some isolation centers have been closed. And the reason that they've been closed is because, remember, when we moved to home-based care, so the only people that were now coming to the isolation centers were the critical cases. So like I initially said, we were having low case fatality rates. That means that the critical cases that we're seeing are not a lot compared to other countries. So we have to have some isolation centers open for sure to manage some of these critical cases. But the truth is, we actually don't need to keep all of them open, because a lot of the cases we're having are mild cases and even asymptomatic cases that we're seeing.
Okay, so should we brace up for a second wave of infection like in other climes?
Okay, so second wave, I wouldn't even say that we're through the first wave, because a lot of countries are talking about second wave. To be honest with you, we're not through with the first wave. So I actually want us to hold back on declaring there's going to be a second. Let's finish with the first wave first, and then we can talk about the second wave.
Okay. Are you aware the federal government has commenced negotiation for vaccine supply in Nigeria? How soon should we expect a vaccine or cure for the virus?
Okay, so the vaccine development, as we currently know, we have over 150 vaccine candidates in development. About 25 are already in human trials, and we have about 5 in phase 3 trials. So phase 3 trials will be testing it in the general public on thousands and thousands of people. I believe even Russia has even gone on to release their own vaccine to be administered to their own population. So I don't know that the phase 3 trials are going to be completed within the next few months. I believe a lot of the trials started in July. So for phase 3 trials, you need time to be able to observe the effect of the vaccine in the general population. So I would caution us to not to be too optimistic, because I've heard people say, oh, by September we're going to have a vaccine, by October we're going to have a vaccine. I don't think that that is going to be enough time for the phase 3 trials of at least these 5 vaccines that we have undergoing trials right now to actually play out, for us to see how effective these vaccines are and how people tolerate them, what will be the side effects of these vaccines or the adverse effects of these vaccines. So we need some more time.
Okay. Are you hopeful we could come up with a vaccine in Nigeria? Are we following up with any clinical trials?
Okay, so as far as I know, there's no vaccine trials in Nigeria that are at least in the phase 1. So I will say that it would be fantastic if Nigeria could come, because we have a lot of smart people in this country. We definitely can do it. But to tell you that we have a vaccine candidate in at least phase 1, I doubt that we've even gotten to that point.
Okay. In the absence of a vaccine, how can we reduce the risk of contracting the virus?
The simple things have always worked. For this virus needs contact between individuals. So the first thing we tell people is, yes, the lockdown has been eased, but if you don't have to go out, you don't go out. And if you must go out, you have to make sure that you have a face covering, because the virus looks for people to be transmitted to. And if you don't give the virus that opportunity, it's not going to be able to be transmitted to anyone else. So remember, stay home if you don't have to go out. Wear your face covering if you have to go out. Make sure you wash your hands regularly. Always use an alcohol-based hand rub if you don't have water and soap available, and always maintain at least 2 meters distance between yourself and other people. So these simple things, they sound so simple. I think that's why people just ignore them. But these are the simple things that can actually protect us and prevent and reduce transmission of this virus.
Before I let you go, Dr. Maduafokwa, what is your take on the effort to start or administer some vaccines for trial in Nigeria or in some African countries? What's your take on that?
Okay, so it's actually my understanding that the vaccine, one of the vaccine trials that is in phase 3 is actually already been administered in South Africa. So the vaccine trial, so for you to do a phase 3 trial, you need to do it in a community or in a situation where the transmission is high. So a lot of the vaccine trials are being done in places like Brazil and in the US, because transmission is extremely high in those locations, and then in South Africa. So there's no way you're going to be able to test the efficacy of a vaccine if you're not testing it where transmission is currently going on. So I believe that's the only thing that the vaccine companies have to do to ensure that this vaccine is properly tested, so that when people are being administered with this vaccine, they'll know that yes, it's efficacious, and 2, it's safe for human use.
Okay, thank you so much, Dr. Maduafokwa, for your resources and time on Sound Health.
Thank you for having me.
I have been talking to Dr. Maduafokwa, a public health physician, on the recent decline in new COVID-19 infections in Nigeria. Dr. Maduafokwa has been talking to us via Skype. Sound Health continues in a moment. Please stay with us. A decline in new COVID-19 cases does not translate to being at the end of the pandemic. Please adhere strictly to precautionary measures such as regular hand washing, use of masks, and physical distancing to beat COVID-19. This is where we say thank you on today's episode of Sound Health. For comments and inquiries, please send SMS to 0035 826603 or follow us on social media at TelTV Social. #Sound Health. A sound health is a sound mind. Make healthy living your choice.